Hey everybody, I just wanted to check in with you to see how everybody's been. Um, I have brushed my teeth and I'm ready to go. We're going to be going to get, see if we can get hospice to come to our home. I am at the hospital right now, and for those of you who do not know me, my name is Miss Christine 55555, and my channel is about following my journey with breast cancer, which it was in my left boob, and they cut that out, and they found there was some in my lymph nodes on my underarm, so they cut that. And then I was in remission for 4 years, 4 years remission. And then not 4 years, 4 months for remission, 4 months remission. And after about 4 months, I started to feel wonky and weird. I started to feel sick to my stomach. I just started stuttering and walking like with my head bobbing. And so I decided to go get to the oncologist and go get this weird phenomenon that was happening to me to discuss it with my oncologist. Well, my oncologist said, well, let's get some vitals, let's get some testing going through, and we'll let you know what the results are. So I'm like, okay, great. And throughout that time, my shaking of my head was getting close, bobbing of my head, and just not really able to remember a lot. And so because of that, I had to go and get look at this thing there. I had to go and get I was able to go and get, sorry, I had a brain fart. I was able to go and get my breasts looked at and tests going through there, and I was able to get my lymph nodes looked at, and there were 5 or 6 that were infected. So I had to go through treatment then, and all kinds of treatments before where I'm at now. Okay, so if you want to know what happened, I've shared all the dirty, messy, fun times, not so fun times, crying times, and I put it all on my true crime channel, and started my true crime channel, or started my adventure with my breast cancer. So sorry, make fun of me if you will, I don't care. I'm still having problems remembering. And as you could say, I've been taking steroids, and it made my face a little so I'm a little swollen is what it would be called. But anyways, so we had that checked and said we had cancer, and we went through a whole year of intense radiation, chemotherapy, immune therapy, white cells therapy, all kinds of stuff, plus a surgery, which they cut off some of my boob and some of my lymph nodes in there. Then afterwards, I was free and clear, no cancer, none. And even with testing, no cancer. So I was staged as a 4-month survivor. Well, wasn't a 4-month survivor. I must have had cancer all that time, and the brain, they have a hard time testing the spinal cord and the brain. So because they didn't can't they didn't capture the spinal cord in the brain in any of the checkings, then I guess that's where it slipped through the cracks. I don't know. So now I have to wear glasses. I've been here for over a month. Um, I've been home maybe a couple times, but that's it. And my animals are missing me, and I'm just tired of being in the hospital. So I will be going home. But before that, I will tell you about what what kind of treatment I have done so far for the spinal fluid um, chemo and radiation. Okay, so far I've been in here for about 2 months, and first month I had um, chemotherapy for a month, and now for the second month coming up, going up. Actually, we're into the second month, and at the end of our second month, um, I have done radiation. Now, that radiation is an hour long every time, and they put this mask on you, and it covers your face like this, and it leaves no spaces behind, and it covers your shoulders all the way down to your waist, and you have to sit there in one area for an hour, and they wanted me to do this 10 times. Yes, you heard me, 10 times. I wasn't. I wasn't able to do it. So I did finish 8. I couldn't finish to 10, which is fine. And pretty much we're going to have to go to another method, and I guess we're going to have to go home and ask if hospice could come to our area. Now, I really don't think that they can come to our area, just because the mannerism of the person that we talk to, they want us to come to hospice um, suites, kind of suites, as far as like a room. They don't want me to go home. They want me to go straight to the room. Well, my husband wants something other than that. And so we're going to really have to try to accommodate what he wants and just go with it. Go with the flow, I guess. So, right, that is what we're doing right now. Is my husband is at home trying to get all the T's crossed and the I's dotted. And I've got my updates and pictures on my Facebook page and this page here that you're watching, or this video that you're watching. So that's what we have. So I'm just telling you, I had to pause there for a minute. I had to have the lady turn me to my finger, pull my finger. Right there, see it? Here's what my fingernails look like they're probably going to fall off. And here's the other side. They're probably getting ready to fall off. You see that? That's from them falling off many times. Ow, I don't know why I'm having cramps in my stomach. Oh, stop it. But yeah, there's cramps in my stomach. Anywho, so that is it. I'm not sure what I had said prior to this because I was distracted. So I do love y'all so much. Thank you for continuing to watch my journey. Oh, I know what it was. So what it was is they said that I would have 20 or wait, no, 6 months to live. That is my doctor's estimation of what I'm doing and what's happening. I will have 6 months to live, says my doctor, which I believe in him. I believe in him, and I hope he's right. I hope he's maybe maybe off on his guess, and maybe I'll live for 16 months. 16 months would be okay with me, and I'm going to work the hardest I can work to get to that point. Okay? So I'm going to need you all to help me. I'm going to be either going into the nursing facility for what is it, hospice, or I'm going to get better and I'm going to go home and have hospice come to my house, that's the one I prefer. But we'll see what happens. So stay tuned. I'm still here. I had to get medicine and all kinds of sorts of things out before I could make any more videos. I'm sorry if this is so boring, but I've taken up 11 minutes of your time. So anyways, if you feel anything that your body does not recognize as something that is normal, please go get it checked. Go get your mammogram checked. Go do as much things as you possibly can to get checked so that you are not in the place that I am. I started off with breast cancer and cancer in the lymph nodes, and now I have cancer in my spinal cord and in my brain. So, and I have 6 months to live, says my doctor, which my doctor is a very intelligent, influential person, and I think that he tells me things that are hard to say because he knows and respects me, and he knows that I just would want to know the truth. No pity party, no poor, none of that. So he knows this, and so he doesn't pity party me. He doesn't, try to make it where I am guessing. He tells me the truth, and sometimes the truth is hard. Sometimes the truth is hard, like saying I have 6 months to live. It was hard for my doctor to even say that, but he knows. I told him. He said, he looked at me when I asked him, how long do I have to live? And he looked right at me, and he was just like, do you want me to tell you? I know that's exactly what he said in his mind. And he still looked at me, and I said, tell me the truth. Tell me what you think your educational guess would be on how long I would have to live. And he said, maybe 6 months or a little longer. That's it. 6 months or a little longer. So 6 months ain't bad, but we want to be up a little higher than that. We want it to be 16 months. But anyways, so go get your mammograms checked, go get your lumps checked, go get everything. You need it. And this little squirty thing, look at this. How cute is this? This is a peep. Look at this little peep. It's a squishy peep. Hear it? My daughter-in-law's mom gave this to me. Isn't that so cool? Everybody's been wanting to know where I got the peeps. Well, this peep was bought at Kroger, or you could buy it at Walmart. Now, they may not be on stock because people went crazy for these. So if you want one, you gotta go to Kroger or Walmart to get it. This little peep right here. Anyways, love you all so much, and I will see you at the next video. Love you. Bye now.